Hello guys, welcome back to my YouTube channel. Today I'm going to discuss about paranasal air sinuses. So I will give you a brief introduction first. The paranasal air sinuses means the air-filled spaces in some bones surrounding the nasal cavity. Here you can see the nose or the nasal cavity, and then you can see the air-filled bony spaces around the nasal cavity. These sinuses open in lateral wall of the nasal cavity, and there are four main paranasal sinuses as frontonasal sinus, ethmoidal sinus, spinoidal sinuses, and maxillary sinuses. Here also you can see the sinuses very clearly. These are the two maxillary sinuses. Then you have the ethmoidal sinuses and frontal sinuses. In this picture, from the frontal view, you cannot see the sphenoidal air sinuses. You can see sphenoidal air sinuses from a lateral view. I will show later. So, what are the general characteristics of these paranasal air sinuses? Developmentally, the sinuses are the extensions of nasal cavity. So, they are lined with thin pseudo-stratified ciliated columnar epithelium, and also they have contained goblet cells. Secretions of goblet cells are drained through the openings of the sinuses into the nasal cavity. I hope you can remember in my previous video I discussed about the nasal cavity and the openings of the sinuses in the lateral wall of the nasal cavity. So I showed you as well what are the openings of the sinuses. So from those openings, the secretions of goblet cells in the paranasal air sinuses drains into the nasal cavity. The main function of the paranasal sinuses is to warm and humidify the inspired air. They add to the resonance of voice, and also those sinuses helps to reduce the weight of the skull as well. So you have to remember the importance of the paranasal air sinuses. The sinuses are filled during expiration. Warmed and humidified air is released in the nasal cavity during inspiration. When we talk about the development of the paranasal sinuses a little bit, those paranasal sinuses develop as evagination or outpouching of the nasal epithelium into the bones surrounding the nasal cavity. I told you earlier as well, those sinuses are situated around the nasal cavity. It occurs during the 3rd to 4th month of intrauterine life. So, lining of paranasal sinuses is ectodermal. The sinuses are not fully developed at the time of birth. The ethmoidal sinus begin to develop before birth. These ethmoidal sinuses begin to develop before birth, and only a few cells present at the birth. Frontal sinus usually absent at the birth. Maxillary sinus are the first developed sinuses. So you have to remember those points. Those may appear in your MCQs. Maxillary sinuses are the first to develop sinuses. Frontal sinuses are absent at the birth. Ethmoidal sinuses start to develop before birth. So you can see only few cells of ethmoidal sinuses. And the maxillary sinuses appear as a shallow groove on medial surface of each maxilla around 3rd month of intrauterine life. At the birth, the maxillary sinus may gradually increase. The first spurt in growth of the maxillary sinus during 6 to 7 years. Actually, the maxillary sinus achieve the adult size after eruption of permanent teeth. Then you have sphenoidal sinuses. Those sinuses begin to develop before birth. Then you have to remember the most important point. The frontal sinuses you cannot see at the birth. All the other sinuses are at the developing stage during the birth. So that is a brief overview about paranasal air sinuses and development of those sinuses. Let's discuss first about the frontal sinus. Here green color shows frontal sinuses. Here is the frontal weave and here is the lateral weave. In this picture you can see sphenoid sinus as well. So when we talk about frontal sinus, each frontal sinus is situated between inner and outer tables of the frontal bone. So you can see this is the inner table and this is the outer table. So frontal sinus is in between inner table and outer table of the frontal bone, above and deep to the supraorbital margin. Above and deep, these are the supraorbital margins and it is situated above and deep to the supraorbital margins. The right and left sinuses are often asymmetrical as the septum between them is obliquely placed. The anterior wall of the sinus is thick and is related to the skin of the forehead. This is the anterior wall of the frontal sinus. You can see it is little bit thick. Posterior wall of the frontal sinus is thin and it is related to the meninges and frontal lobe of the brain. Inferior wall forms the roof of the orbit. You can see this is the orbital cavity. This is the orbital cavity. Here this is the orbital cavity. So you can see this is the inferior wall of the frontal sinus. It forms the roof of the orbit. Frontonasal duct begins in the opening of the sinus, which is located in floor of the sinus. Usually frontal sinus opens by this duct in anterior end of the infundibulum in the middle meatus. So in this picture you can see this is the middle meatus. So here you can see the hiatus semilunaris in this area. So this is the area where frontal sinus drains in the middle meatus, infundibulum of the middle meatus. Then supraorbital nerve, branch of frontal nerve, supplies mucous membrane of the sinus. Frontal sinus is marked on the surface by drawing a triangle joining nasion a point 3 centimeters above the nasion. Nasion means here 3 centimeters above the nasion. A point at the junction of medial third and lateral 2/3 of the supraorbital margin here. So when you join these 2 points together, you can surface mark the frontal sinus. Next, I will discuss about the ethmoidal sinuses. The ethmoidal sinuses you can see here in blue color. These are the ethmoidal sinuses. These sinuses are thin-walled air cells in the labyrinth of the ethmoid bone. Ethmoidal air sinuses situated in the labyrinth of the ethmoid bone, located between upper part of the lateral nasal wall, and medial wall of the orbit. Roof is related to meninges. Here the roof is related to meninges. In the anterior cranial fossa, the lateral wall is formed by paper-like lamina bone called lamina papricea. This wall is extremely fragile, hence slightest injury to it can lead to spread of ethmoidal infection to the orbit. There are 3 groups of ethmoidal sinuses. The anterior group opens into the anterior part of the infundibulum of the middle meatus. Then the middle group projects in the middle meatus, producing ethmoidal bulla. The middle group opens at the summit of the bulla. Then the posterior group opens in the superior meatus. The ethmoidal nerves, the branches of nasociliary nerves, orbital branch of maxillary nerve supplies mucous membrane of the sinuses. In this picture, you can see this is the area where bulla ethmoidalis. Bulla ethmoidalis. Then you can see uh, this bulla ethmoidalis means a bulging of the bulging which is formed by the middle ethmoidal sinuses. Here you can see this point is the infundibulum, which anterior ethmoidal sinus is drains, and then um, the middle meatus, the middle ethmoidal sinuses drains into the here middle meatus in this area because it is situated in behind the bulla ethmoidalis. Then posterior group of ethmoidal sinuses drains into the superior meatus. Here you can see this is the area where posterior ethmoidal air sinuses drains into the superior meatus. Next, I will discuss about the sphenoidal air sinuses. These sinuses occupy body of the sphenoid bone. Here you can see in this picture you cannot see the sphenoidal air sinuses. Only the lateral view shows the sphenoid sinus. You can see it is situated in the body of the sphenoid bone. The right and left sinuses are separated from each other by a deflected bony septum. The two sinuses are therefore asymmetrical in size. Each sinus opens in the sphenoethmoidal recess of the lateral wall of the nasal cavity by an opening situated in the upper part of the anterior wall. Relations of the sinuses are surgically important, especially during transsphenoidal hypophyseectomy. Transsphenoidal hypophyseectomy means hypophysis means the pituitary. The anterior part of the roof is related to the optic chiasma. Here the roof, so the anterior part in this area it is related to optic chiasma, while the posterior part of the roof is related to pituitary gland. This is the hypophyseal fossa, and pituitary gland is situated in the hypophyseal fossa. Each lateral wall is related to cavernous sinus, internal carotid artery, oculomotor, trochlear, abducent, and three divisions of the trigeminal nerve. Posterior ethmoidal nerves and orbital branches of maxillary nerve supplies mucous membrane of the sinuses. The clinical correlation with the sphenoid sinus is, I told you earlier as well, the transsphenoidal hypophyseectomy. So how it is done, how surgically approach to the hypophysis. Due to anatomical proximity of the sphenoidal sinus and pituitary gland, the sinus is used as a route to approach the gland in a procedure called transnasal transsphenoidal hypophyseectomy. Transnasal means like this from intranasally, transnasal, transsphenoidal across the sphenoid sinus. We go into this hypophyseal fossa, then to the pituitary gland. Mucoperiosteum of the nasal septum is elevated on both sides to reach the sphenoid bone via the roof of the nasal cavity. Then the next type is maxillary sinus, the fourth type. The maxillary sinus is the largest paranasal air sinuses. Here you can see the green color one. These are the two maxillary sinuses. Here this one is the maxillary sinus. It has the capacity of 15 milliliters in adults. Each sinus occupies body of the maxilla of its side, pyramid shape with base, medial wall, directed towards the lateral wall of the nasal cavity. Actually, this is somewhat pyramidal in shape. The medial wall of the maxillary sinus is directed to the lateral wall of the nasal cavity and apex pointing laterally towards the zygomatic bone. This area is the apex. It is pointing laterally towards the zygomatic bone. In this area, you have the zygomatic bone. When we talk about the relations of wall of the sinus, anterior wall is formed by anterior surface of the maxilla covered by cheek. Roof forms floor of the orbit. This is the roof of the maxillary sinus. It forms floor of the orbit through which travels infraorbital nerve. The floor is formed by alveolar and palatine processes of maxilla. Here is the floor. So it is formed by alveolar and palatine processes of maxilla. And the floor is located about 1 centimeter below the floor of the nasal cavity. The roots of the upper molar premolar teeth almost project in the floor of the sinus. Therefore, the bone is very thin here. The bone is very thin. Extraction of upper molar or premolar teeth may lead to a communication between the sinus and the oral cavity. For the same reason, if there is an infection from caries teeth is a common cause of maxillary sinusitis. The medial wall, this one is related to lateral wall of the nasal cavity. Superior part of the medial wall bears opening of the sinus to the middle meatus. The high position of the opening hinders natural drainage of the sinus. Because of this position, according to gravity, it is difficult to drain into the nasal cavity. This opening is reduced in size in living state by following bony parts, the uncinate process of the ethmoid bone above, a descending process of lacrimal bone in front, and perpendicular plate of palatine bone behind. The pus of frontal sinusitis may run via hiatus semilunaris to the maxillary sinus because location of opening of these sinuses favors passage of pus from frontal sinus to maxillary sinus. You have to remember that point as well. Pus collection in frontal sinus can drain into maxillary sinus because these openings are related very closely, and frontal sinus as well as maxillary sinus drains into middle meatus. Like, in this picture you can see this is the area where maxillary sinus drains, and this is the area where frontal sinus drains. So if there is a pus collection in the frontal sinus, it drains here. According to gravity, you can see maxillary sinus. This pus can drains into the maxillary sinus as well. So maxillary sinus is little bit lower down than this opening. So it is very difficult to drain from the maxillary sinus. So it is also a problem. This is the maxillary sinus. So the posterior wall is related to contents of the infratemporal and pterygopalatine fossa. This area is the infratemporal and pterygopalatine fossa. There are some clinical correlations of maxillary sinus. The maxillary sinus is more prone to infections in chronic smokers because epithelium loses cilia, and therefore it difficult to drainage then drain secretions of the sinus. Maxillary sinus is very often filled with pus due to poor natural drainage according to the gravity, and due to its position. There are two surgical approaches to maxillary sinus. In intranasal antrostomy, an artificial opening is made in the lateral wall of the inferior meatus of the nasal cavity. This opening is closer to the floor of the sinus. Therefore, it facilitates the drainage. The other one is called well-look operation. The upper lip is retracted upwards. From the upper lip is retracted upwards like here, and the angle of mouth is retracted laterally. An incision is placed in the mucous membrane and periosteum covering the canine fossa. This exposes the anterior wall of the sinus closer to the floor. An artificial opening is created here to drain pus. The other one is the maxillary sinus is the common site of malignancy in paranasal sinuses. The cancer of maxillary sinus initially may present as symptoms of sinusitis. However, it is easily spread in the neighboring regions because the wall of the sinuses are very thin. Symptoms and signs depending on the anatomical structures closer to this maxillary sinus. Invasion of the medial wall of the sinus causes obstruction of the nasal cavity and epistaxis. Involvement of the anterior wall gives rise to swelling of the cheek, spreading through the floor, result in dental pain, loosening of teeth, ulceration of gums, and swelling of hard palate. Superior spread involves the orbit, causing proptosis, ocular pain, and epiphora. Posterior spread in the spinopalatine fossa may cause pain in the areas of distribution of maxillary nerve. And spread into infratemporal fossa may lead into trismus. Those are the clinical correlations with regards to this maxillary sinus. So that's all about the four paranasal sinuses: frontal layer sinus, maxillary sinus, ethmoidal and sphenoidal layer sinus. I forgot to show you the opening of sphenoidal layer sinus. Here is the sphenoid air sinus. So this is the posterior, this is the superior meatus. So from the opening of sphenoethmoidal recess, sphenoidal air sinuses opens into the superior meatus. So that's all about the air sinuses. Hope you guys got a clear understanding about the four air sinuses and what are the clinical correlations with regards to those sinuses. Thank you for watching.